Well, hello, my friends. How are you? We are coming into the fall. Here in Colorado, the leaves are already starting to turn. So, driving through my neighborhood, we have one tree. It's so funny. We have one tree that is already like orange, yellow. Half of it is orange and yellow, and half of it is green. And then all the other trees are still green. It's so funny. This one tree is like, I'm going to be the first one to change my colors. It's so funny. But we just got back from the mountains last week, and the leaves are not quite turning yet up in the mountains, but we're hoping that we're going to be up there in a couple more weeks. We hope that we'll be able to see those aspens turning those bright yellow and orange colors. It's so beautiful up in the Rocky Mountains in the fall. And whenever the trees start turning color, that's always a tip for me that we need to talk about end of year. And at the end of the year, well, the last few months of the year, this is when we will start to want to talk about patients' benefits starting to want to renew maybe in January. Now, this conversation usually happens around September because I want you to start with an outreach program that is a little bit more robust than normal, because most insurance plans, not all, most insurance plans are going to renew in January, which means that if your patients don't use up their dental benefits by the end of December, they will lose those benefits. So for those of you that might be new to dentistry, what that means is most dental plans have somewhere between $1,000 and $2,500 of dental benefits available. I don't like to call it insurance because it's really not insurance. It's a benefit, and it doesn't pay for very much, but it is a small token of appreciation for spending thousands of dollars on insurance premiums. We're going to give you this small token of our appreciation in dental benefits for the year. And chuckle. And so most patients will get somewhere between $1,000 and $2,500 per year to use on dental treatment. And so most dental plans have a renewal period that starts in January. Now, there are some insurance plans. I'm originally from the state of Washington, and our school districts renewed September 1st. We had a Boeing plan that renewed on July 1st, and we had I think a large county or someone that started March 1st. So we had some odd plans up in the state of Washington. You may have some plans that renew mid-year, but most dental plans are going to renew January 1st, which means that your patients, woohoo, they get a new benefit. They get their $1,000 or their $2,500 benefit starting January 1st. So what that means is we want our patients to use up their benefits before the end of December. And right now is a really good time for you to start a bigger outreach to these patients that still have remaining benefits. So I'm going to give you some tips on how you can do that. If you are using a third-party vendor, hopefully you are using an approved and authorized third-party vendor for your integrations with patient engagement, then you might be able to do some kind of an email blast or a text message outreach for patients that have unused benefits. So I would definitely reach out to your third-party vendor and find out if they have some kind of a campaign that they can send out to your patients, so we can encourage patients to reach out to you and get scheduled for unscheduled treatment. I'm going to tell you how to do it inside of your Dentrix software, because if we can stay inside of our Dentrix software as much as possible, it will increase your efficiency and your productivity throughout the day, because you're not having to go back and forth between different platforms. And so how we can do that outreach in your Dentrix software is by using the Treatment Manager. The treatment manager is one of my favorite reports in Dentrix. In fact, I give it a nickname. If you've listened to me before talk about the treatment manager, you know that I call it mining for gold because it is a gold mine. And so if you have never used this report before, it will blow your mind. It is one of the most powerful reports in Dentrix for finding patients that are unscheduled. If you have a new associate in your practice, if you have a doctor's schedule that is not full, if you have doctors that are maybe doing hygiene because their schedule isn't full, the treatment manager will fix that. This report is so powerful. And I recommend that you have someone on your team that is working the treatment manager at least a couple times a week, just to be proactive. When patients come out of hygiene and they have treatment that needs to be scheduled and the patient leaves and they say, you know what, I have to think about that. I need to talk to my husband, or I need to get financing, or whatever the conversation is. A lot of patients walk out the door without scheduling treatment. And so it's really important that we are following up proactively to get those patients scheduled. So the treatment manager should be part of your weekly routine. In fact, one of our most popular courses in our membership is called Daily, Weekly, Monthly Best Practices, or maybe it's Best Practices Daily, Weekly, Monthly. And part of that weekly protocol, part of that weekly process is following up with patients who have unscheduled treatment. Now, there are lots of other weekly processes inside of our course, but today I'm talking about unscheduled treatment, and you have a lot of it. I know you do, because I look at this report every single time I do a practice assessment. And so I remember one time I was working with a practice, and we looked at the treatment manager, and we just looked back like, I don't know, 6 months, maybe 6 or 8 months worth of treatment. And the doctor came up behind us and he's like, "Oh, what's that report?" And I said, "Doctor, you might want to sit down." And he goes, "Why?" I go, "Because you might faint when you find out how much money is sitting on your books that's not in your schedule." And there was over $3 million of treatment, unscheduled treatment, sitting on the treatment manager that was unscheduled. And what an opportunity, really, when you think about it. It's just an amazing opportunity. So this report is your report this is your outreach program. And so you can find this report. You can either find the treatment manager on the appointment book. It's the green chair with the $sign on it, or you can find it in the patient chart. And so you open up the treatment manager. Now, I don't want you to get too overwhelmed, because as soon as you open the treatment manager, then you're going to have a new window. And this window is going to have lots of check boxes. You're like, oh my gosh, I don't even know what to do here. There's only going to be a couple things that you really need to worry about. Number one is inside the middle of that window, I want you to select patient as the status. You don't need inactives or non-patients. So make sure you just highlight patient. The other thing I want you to do is kind of at the top, kind of in the middle, there's a dated from. And so, because I don't want you to look for treatment dated from like forever, okay, that would make you have a real super long report. You don't need that. I would only go back maybe 6 months, 6 to 12 months, maybe. Okay. Maybe from the beginning of the year, maybe go back to January 1st of this year. Okay. So everybody that's had something treatment planned this year is going to show up on your report. So click in the dated from and put in, January 1st, 2025. Then leave everything else alone unless you really want to focus on patients that have remaining benefits. So that's our topic today, is patients that have remaining dental benefits. So the kind of the bottom of that window, you're going to see a section that has insurance benefits remaining. So if you only want to find patients that have remaining benefits, then fill in that section. For this podcast And for your outreach program for patients that have unused benefits, this is what I would do. And then you can click OK and generate the report. Don't worry about any of the other things in that window. There's just too much going on. You don't want to filter the report down too far. Now, one thing that I used to do in my own practice is I used to generate this report, and then I used to drop it down to an Excel spreadsheet because I could then upload those email addresses into my third-party software. I don't know if you can do that anymore with third-party vendors, but you can double check. But when you generate this report, the treatment manager, it is going to open up a interactive report. You don't have to print this report. It's very interactive. Once you generate the treatment manager, there's going to be lots of columns of information: patient name, treatment plan total, last date of the treatment plan, and so on. Now, what I really want you to focus on here is there's a column that is next appointment. Next APPT. Okay, I want you to look for that next appointment column. And I want you to tap on the top of that next appointment column. Okay, now what happens is it's going to filter, it's going to resort that column. It's going to float all the patients that have no appointment for anything up to the top. So that's where I would start for sure. So now that you have this report, you can pick up the phone, old school, pick up the phone and say, hey, Dayna, I'm just checking in. I know you still have some remaining dental benefits this year. We still have that crown on the lower right we need to do. I would highly recommend that you try and get that done this year. Otherwise, you're going to lose out on those benefits. Now, you also might be able to text that patient directly through your software. However you want to reach out to that patient, I think that right now is a really good time to do a bigger outreach. Okay, now, if you want more information or you want to maybe jump into the membership so you can take my course, please book a call with me. I would love to talk to you about how we can engage you in getting your schedules full, reaching out to patients that are unscheduled. That's what we do every single day. And I love it. So I hope that this episode has been helpful. I'd love to hear how your outreach program is going for patients that are unscheduled and have remaining benefits. So drop me a comment on this podcast. If you're watching it on YouTube, feel free to use the comment section. If you're listening to it in the car, maybe you could just drop me a line when you get back into the office. I'd appreciate that. You can also share it with your colleagues. So if you are in a study group or maybe you have a DPLN chapter in your area, share it with your other office managers. I really appreciate that. All right, my friends, I hope that you have a great rest of your day, and I look forward to watching your journey of becoming a high-performing dental team.